the show.
Thank you.
So you are as far as I understand, a clinical hypnotherapist. Is that it?
Correct.
Yes.
I actually call myself a mind therapist. So because I deal with everything related to a mind. So mainly hypnotherapy, but there will be a bit of counseling involved, a little bit of trauma work involved. That's where I do EMDR, schema therapy. I do a little bit energy work as well. So it's all in one.
Oh wow.
So I deal with the mind. That's why the term mind therapist.
I see. Okay, but so the hypnosis part is just one of the things that you do.
That's the main.
That's the main
yes.
one, all right.
Yes.
Do you get anyone who's like scared? They're like, oh no, you're gonna hypnotize me. You're like,
So often. So
often.
Friends are like, don't look at me, don't look at me. That's very common.
Right.
And they're like, can you tell me what you're thinking? That kind of thing.
Right. Okay. Because I'm sure that people are scared of, but you couldn't actually hypnotize me right now. Can you? No, right? No, not
I
in
can
this kind of
only
setting.
do it if you want to. So it's all about cooperation. It's not about control.
So I have to be in on it.
Yes.
In order to be okay. All right.
So you're safe. You're safe.
I'm safe. Okay. I'm not gonna turn into a chicken or anything like that. No.
Not yet.
Okay. So you treat people with different sorts of conditions.
Yes,
What's the
yes.
most common type of condition that your patients or clients face?
I would normally look at anxiety. If I were to be brave enough to say, I would say 90% of my clients are on anxiety, but they come for different reasons.
I see.
They'll come for OCD, they'll come for depression, they'll come for trauma, they'll come for insomnia.
Okay.
But the underlying cause is anxiety.
Oh, so anxiety is the basis for all of that?
Majority of it. So when I deal with anxiety, that would be the root cause.
I see, okay.
So that's the majority of it.
And anxiety doesn't actually, anxiety equals stress, because I thought anxiety and stress is the same thing. It's not.
The way I look at it, right, is a continuum. So everything starts with stress.
Everything starts with stress. Okay, I'm gonna.
we are all getting there.
Okay.
So it starts with stress.
Okay.
If stress is not monitored, it'll go on to anxiety.
Okay.
If anxiety is not managed, it'll go on to depression. It'll go on to OCD. It'll go on to insomnia. It'll go on to other issues.
So you mean to tell me that if I get really stressed at work,
Yes.
like even just office stuff,
Yeah.
and that goes unchecked,
Yes.
it will eventually make me...
Possibly. So it really depends on how you cope with stress.
I see.
Yeah. So
Okay.
some people, they are much better able to manage your stress.
Right.
And they won't get it. So it's good to do some preventative measures, right?
I see.
But if not, once you go overboard, panic attacks will come, and the whole depression will come.
I see. Okay. You mentioned OCD because you know how people say like oh my god, I'm so OCD, and what they mean is that they have like they're really super organized, or they're very
tidy and stuff.
tidy, but that's what we think OCD is. But what does OCD really mean?
Yeah, it's a very overused term, right? Like you were saying. But OCD is really when you have that obsession towards a particular thing, or the compulsion to do something.
Yeah.
Okay, so being neat and all is just maybe your preference, but having that compulsion is that I just have to open that doorknob, and I have to do it 10 times.
Ooh.
If I don't, something bad's gonna happen.
Oh.
Yeah, so it's not that I want to wash my hands that often. It's that if I don't do it properly, or if I don't do it enough, the germs will kill me. Yeah. So whereas obsessive thoughts would be where I keep on ruminating about a particular thing. Like, how am I going to step out this door? How am I going to step out this door? Do I use my left foot first? Do I use my right foot first? If I step out now, would something happen? So it's all these thoughts that actually paralyze someone until you can't do something. That's why it becomes that D in OCD. It becomes a disorder.
I see. Okay. Wow. Okay. And not everyone who experiences stress will develop OCD, right?
No,
It's something that only a small subsection of people who ended up there. Okay, that sounds really debilitating. That's how do you even begin to treat people like that?
I think one of the most important thing is to let them know that you can be helped. Because a lot of OCD patients, they are like giving up, and they find that they just can't do anything.
Okay.
But once you know that there's help, normally my style is that I get to root cause. OCD and all these compulsions, they're more symptoms.
Okay.
So I'm not going to work on symptom, because if I do, the root cause is still there, it's still going to affect you.
Oh, I see.
Right? So normally I ignore symptoms to get to root cause, which is normally that maybe anxiety, or very common is trauma as well.
Trauma.
Something traumatic may have happened, which causes me to have that fear, and then I react with all these kind of things.
Something that's happened before in their lives, which causes them to react that way. I see.
Let me give you an example. There's this person that I met some time ago. She's extremely afraid of dirt, until it's very difficult, because walking on the streets, she can't walk near a drain.
Oh, okay.
Even if the floor is clean, right, she can't go near a drain or a dustbin.
Okay.
So, long story short, after doing the whole hypnosis, regressing her to her past, she was about late 20s, went back to when she was maybe like 5 or 6, and in her grandma's house, the dog pooped. And she stepped on the poop and brought the poop into her house. Of course, accidentally. And that's where the grandma whacked her. So that trauma stuck to the fact that it's dirty.
I see. So there's an association of where the anxiety and pain comes from. I see.
So it's so once you get to know the root cause, just tell her that it's safe right now. Your grandma did something wrong. Let's forgive her, and it's okay with dirt. It happens, and things just get better that way.
And she's in her late 20s. I see. Okay.
So it's like more than 20 years she's holding on to that trauma.
Oh man. Okay. Well, I'm happy to know that you're helping these people. I'm happy to know that she's a little better at home. Because walking down the streets of KL is
everywhere.
Yeah.